Sleep apnea. What is sleep apnea? It's a common, however serious, disorder in which you have one or more pauses in breathing or shallow breaths while you sleep. Breathing pauses can last from a few seconds to minutes. They may occur 30 times or more per hour. Typically, normal breathing then starts again, sometimes with a loud snore or choking sound. Are you at risk for sleep apnea? Sleep apnea can affect anyone at any age, even children. Risk factors for sleep apnea include being male, being overweight, being over the age of 40, having a neck size of 17 inches or greater in men and 16 inches or greater in women, having large tonsils, a large tongue or a small jawbone, having a family history of sleep apnea, suffering from gastroesophageal reflux, also referred to as GERD, nasal obstruction due to deviated septum, allergies, or sinus problems. It's also a point to mention that just because it says you might be 40 years of age or older, you might be male, you're susceptible to it, you're not. You can be female, you can be of normal weight and still be susceptible to sleep apnea. Children can have it, teenagers can have it, 20 years of age can have it, or 30 years of age can have it. So just because it's listed, that's the most common occurrences of who it happens in, but it can happen to anybody. Common signs and symptoms of sleep apnea are high blood pressure, stroke, heart failure, irregular heartbeats and heart attacks, diabetes, specifically type 2, depression, worsening of ADHD, morning headaches, weight gain, and sexual dysfunction, excessive daytime sleepiness, to the point that you could fall asleep behind the wheel of your car or even fall asleep at your desk during work. Loud disruptive snoring, irregular breathing such as gasping and long pauses or loud pauses during sleep, poor concentration and forgetfulness, night sweats, frequent urination, and lack of energy. Consider some of these statistics. 83% of people with high blood pressure also have sleep apnea. 58% of people who've had a stroke have sleep apnea. 72% of type 2 diabetes patients have sleep apnea. And 40% of newly diagnosed sleep apnea patients are women. With the women, it's usually a little bit more common if they're going through menopause, which contributes to the night sweats. Did you know drivers with sleep apnea are just as dangerous as alcohol-impaired drivers? So if you fall into any one of the categories, lack of energy, falling asleep at your desk, sexual dysfunction, night sweats, anything like this, usually lack of energy and falling asleep are the two main key factors when a doctor is going to test to see if you have sleep apnea. To test for sleep apnea, you do a sleep study. A sleep study is done in the comfort of your home, wearing a sleep study machine for the night. Your doctor may recommend where you should go to make an appointment for your sleep study. Sleep studies are free. This here is an example of a home sleep study device. Just attaches to your forehead with an adhesive tape. The hoses from the machine go into your nasal cavities to register for oxygen intake. You calibrate at the start. If it falls off or comes disconnected during your sleep, a voice will come across the machine to ask you to recalibrate. You hit the on-off button to recalibrate and you start over and continue on with your sleep. What is the purpose of a sleep study? A sleep study will provide your family doctor with pertinent information from the testing results. The following are key points of the sleep study: Apnea-Hypopnea Index, also referred to as AHI, Respiratory Disturbance Index, RDI, lowest oxygen desaturation, REM sleep, how long you're in for REM sleep, and Epworth Sleepiness Scale. How is sleep apnea treated? Continuous positive air pressure, also called CPAP, is a treatment in which a mask is worn over the nose or your mouth while you sleep. The mask is hooked up to a machine that delivers a continuous flow of air into the nose. This airflow helps keep the airways open so that breathing is regular. CPAP is the most common treatment for sleep apnea. There is also a bilevel positive airway pressure, or BPAP, which is similar to a CPAP, but the airflow changes when you breathe in and out. In extreme cases, when a patient still has her tonsils, surgery might be the only option considered to have this corrected. Here is an example of a sleep study. Over to the left here, we have the patient's information such as their age, their height, their general, the BMI, whatever health history that might contribute to this, such as diabetes, stroke, or a heart attack. Over here to the right, it has the AHI levels and the RDI levels, the overall levels for the night that the sleep study was done, the levels when they were laying on their back, when they weren't laying on their back, which could have been their left, right side, or their front, and the time when they were through REM sleep. Here at the bottom is sleep disorder breathing events. All these screen here that you see showing up, this is when all the worst part of the apnea took place. When the person was struggling for their breathing, almost a suffocation, and if you can see here, the green bars are quite lengthy. So this patient was in quite a bit of distress while sleeping during the night. This continues on with the examples of sleep study. This page here shows your oxygen saturation, the head position, awake or asleep by the actigraphy, and snoring with arousal indications. All these ones here, all these 4 charts, all combine based off of the oxygen saturation for the most part. If you see here, just for a quick example, these parts here, these long striations, show when the patient was up and awake. All the rest of this is when they were sleeping. And down here is quite interesting as well because it shows the decibels of their snoring, anywhere from 0 decibels up to 70, and for this patient here, most of it was in the 70 decibel category. The last part of the sleep study is pulse rate with arousal indicators, so this is when the person could be up and about, or even struggling to get their oxygen in when they were sleeping. And this was excluded from the analysis, but also can be done as the oxygen level, which would be used by an O2 meter. And the O2 meter here is just a small machine, attaches to your finger. At first you attach the machine to your left ring finger and then turn it on to get your most accurate reading. Once you turn it on, it'll flash for a few seconds just to calibrate. And then once it goes green, you get your instant readings of your oxygen saturation levels as well as your pulse. So for me, it's 96 with a pulse of 109. CPAP machines. This is the most common type of CPAP machine. This one here is the Philips Respironics System 1. Machines come with tubing, memory card, heated humidifier chamber, Bluetooth capability, and air purification filters. This here is an example of the same machine that showed on the screen, the Philips Respironics System 1. Over here you have your dials that show that you can add on for humidifying, for the rate that the pressure would come through for the air. Over here is where your hose gets hooked up. If you open this up here and take this tray out, this is your humidifying chamber. This is where you put distilled water and only just distill water into it, just up to the line level here. Once it's filled, pop it back in the machine, close down, your hose would be attached, hit start, or it might automatically start for you depending on how the machine is configured. If you turn it here to the back, you'll see a place for your power outlet to go, as well as the memory card for the machine. The memory card, it's just like your basic camera card, just slides in the back of the machine to keep your readings. And where it is Bluetooth capable, you can do your readings off the phone. You download the Sleep Mapper app and it'll upload your information every night for you. With regards to the tubing, this is an example of a CPAP tube for the machine. Heated air can go through this. It's usually a specified tube or a specific tube, but the air or the heated air from the humidifying chamber travels through here. And here's an example of one of the masks that would just be placed over your head. And this one here has a bit more of a nose piece just to give extra support to the patient. CPAP mask. As you can can see here, this is only an example of the 6 types of masks that are available. Depending on if you're an open mouth breather or a closed mouth breather, the mask may vary. If you're an open mouth breather, usually it's a full face mask like this, because some people find it hard with a CPAP mask just to have it on your nose and keep your mouth closed while you're breathing. They feel that they're gasping for air or there's a shortness of air. So these here are just 6 examples of the different types of headpieces and how each one is set up. This is the end of our presentation. I would ask if you would fill out the presentation evaluation form that will be handed around. And if you have any questions, I'd be more than happy to answer them for you. Thank you very much.
All right, good, we got it.